Dental treatment is very important for everyone, important for kids, adults, as well as for old patients. You have to take care of your teeth. If your teeth are fine, if your teeth are in good shape and size, and if the teeth are functioning properly, you will have good digestive system. If you can grind your food properly, if you can grind and swallow your food properly, you will full, your food will be in the stomach and will have a good digestion, and afterwards you won't be having any problem. So mouth is the gateway wherein you have to keep your teeth properly. You have to safeguard the interests of the teeth. You have to safeguard everything about teeth. Okay, you have to take care of your teeth properly. Important things I'll just briefly explain. In the childhood, that is in the deciduous or the milk dentition period, that is between birth till the 6 years of the kid's life, there are the milk teeth. There are about 20 milk teeth which will erupt and it will fall off. The mixed dentition is between the 6 to 12 years, wherein you have both mixed as well as the milk teeth as well as your permanent teeth eruption will be there. After 13 years, or maybe if the late shedding is there, after 13 and 14 years, the kid, the adolescent will have all set of the permanent teeth, that is about 28 teeth will be there in his mouth. So if there are, if all the wisdom tooth, that is the third molar tooth, erupts in all the quadrants, so then the patient will have 32 teeth. Excluding wisdom tooth in all the four quadrants, it will be 28 teeth. Okay, so normally it will be 28, including third molars, it will be 32 teeth. Okay, the main problem the patient faces during this 18 to 22 years age is impaction of the third molar. Okay, your third molar teeth is erupting in the mandible as well as in the maxilla. Usually there won't be much space for the eruption of that particular tooth, so it has to pierce the gums, it has to pierce through the bone and has to come out. When there is no space, it cannot erupt properly, so the tooth will be impacted inside the bone. Some part of the tooth structure may be visible in the oral cavity, and the remaining structure may be it's locked inside the bone. In such cases, we have to do a surgical procedure to remove that impacted tooth. Okay, so usually the impacted third molar teeth will not give any problem unless it's completely erupted or it's completely embedded inside the bone. When there is a partial eruption, when there is an angulation and impaction, it will give problem like a foot lodgement, so pericoronitis. So that is the pericoronitis is the infection surrounding the flap, the tissue of the third molar. In such cases, a patient has to go for extraction of third molar. That is, we will do the surgical extraction of third molar by trimming or by cutting the bone which is covered on the tooth surface, or it's joined with the tooth surface. Okay, so we do the surgical extraction of third molar teeth, that is the removal of impacted tooth. So this is what the problem usually the patient suffers between 18 to 22 years. There is the impaction of third molars. Okay, if all the third molars erupted properly, no issues, no problem. Okay, only thing is you have to take care of the third molar area. We have to brush properly, or otherwise if there is a foot lodgement, again there is a caries, pain, all those things. So third molar teeth has to be taken care of during this age period of 18 to 23 years. Okay, during this 18 years, so that is adolescent age, another problem is the proclination of the teeth for the patients. This proclination or the tilted tooth, that is sometimes we call it as the irregular alignment of the tooth, happens when there is a delayed eruption of the permanent teeth, or otherwise if the permanent teeth has erupted in not in the particular place where it has to erupt, if it has erupted buccally, lingually, or if it is rotated, or if it is embedded in the bone. In all such cases we call it as irregular teeth alignment. In such cases the patient needs orthodontic treatment to correct his teeth, to bring all the teeth to proper alignment, to proper shape. Then the patient will have good smile. Okay, so the orthodontic treatment is very important for those patients who have proclined teeth during this age period of between 16 to 22. If they undergo the orthodontic treatment during this age, okay, they will have the proper set of teeth, proper aligned teeth after the orthodontic treatment. So afterwards they can gain confidence out of this orthodontic treatment. Okay, so their confidence will be more because they have good smile, good teeth, good aligned teeth. So you have to be taken care of these orthodontically mal aligned teeth during this period of 18 to 20, 22 years. Go for the orthodontic treatment if it is necessary. Okay, don't leave it like that. Later on, you may feel shy if you have the proclined teeth or the rotated teeth or irregularly aligned teeth. You may feel shy to talk to the people. You may feel shy to interact with the people. So you may feel shy to do something. You may feel shy to smile